G'day folks, and welcome back to part 2 of our conversation with Josh Makower, engineer, physician, MedTech entrepreneur, and venture capitalist. A true Renaissance man, he is also a musician, artist, wine connoisseur, and admirer of all things Italian. In this episode, we will further explore his career contributions. So let's move on to some work experience.
Yeah.
So your time at Pfizer seemed to be very foundational. Why was it so impactful?
Yeah. So, I left medical school, graduated, did not have a job. I foregoed the match. I did not match, chose not to match, and which my dean did not like, by the way. He was very disappointed in me for not matching, but I didn't want to match. I had other things in mind. And I was looking for a job, and during the summer I was a camp counselor.
Okay.
and I sent one good piece of advice that I like to share because I think this is a great idea for anyone, is when you want to get a job somewhere, you shouldn't be looking at the job postings. You should be sending a letter to the people or the organizations you want to work for whatever reason, and write to the highest level person whose email you can get. Or at that time, there was no email. It was like, write a letter. So I wrote to the head of, I wrote to the CFO, I wrote to the CEO. I'd like to have a job, creating new technologies and, or in working, business development or technology development. And the CFO of Pfizer,
No way.
pulled my resume out of his stack. He was also the VP of strategic planning, literally, and said, come on in. I remember waking up on my water bed, in my parents' house, in our, the basement, where camping out while I'm a counselor.
Yeah,
and
the water bed's a little TMI. TMI.
Yeah, too much of it. Anyway, and remember, I was a musician. I'm Andrew. But anyway, and being like, hello, and it's, this is, Hank McKinnell from Pfizer. Would like you to come in and interview. I was like, well, yes, sir. I will be right there. Geez, I hope I have a suit. And anyway, got hired. And, shortly into my tenure there, Hank calls me to his office and he says, good to have you here. I got a special project for you if you're interested. I want you to figure out why is it that when we buy these little companies that are very innovative, when they are independent little companies, we buy them and suddenly they really stop innovating effectively. Like, what's going on? Figure it out. And so I was like, awesome, I'll go figure it out. That one moment changed my career forever.
Yeah.
And that led me to a investigation of, I actually, under the banner, CFO told me to do this. I was able to, my boss was like, what are you doing? I'm like, I can, I'm still doing my job. I can do this too. And I interviewed all the founders and the founding teams of the companies that created the businesses that were divisions of Pfizer, and then interviewed the leadership of the current teams inside of Pfizer. And that's where the insight was, that about how they created things. Like, when there's an independent little company, just like a startup, they're trying to solve a problem and they're looking to get a technology to solve that problem. And then when they're when they're suddenly like a balloon company or a laser company, then they're just looking to see, where can I use a laser?
Yeah.
And that led them down a very narrow and incremental path. And so being limited by who you think you are because and defining yourself around a technology rather than sort of a customer was really interesting. And so just brought that up to Hank and was like, I think this is it. And we should do, if we wanted to be innovative, we just need to focus on needs first. Go to the target audience we want to work on. So, well, go ahead and prove that we can do it. And so I got a little budget and I created this thing called the Pfizer Strategic Innovation Group. And we basically, blocked out the origins of what is now the biodesign process, but we sort of operationalized it. And then, in MIT, the thing that I really, and I can only think about things simply. I have to break it down into steps. And so for me, to be able to teach something, you got to teach the steps, right? So for me, it was like, okay, well, what are the steps? And so that's where, the need finding and all that started. Yeah.
It's not a bad first job.
Yeah, it was pretty good.
Yeah.
But I think the lesson for, younger people who are watching this is you got to keep your head up. Like those opportunities, I've heard like Ron Dollins and people like that talk about this too. Like you gotta, like these opportunities come by and you will miss them if you are just not open-minded. Like we were talking about, like no plan.
Yep.
Like be open to that thing that just comes up like today and go, that could change everything. Like, and sort of be open to it rather than keeping your head totally down. Yeah.
All right. So then I think you've answered really the next question.
Yeah.
Was why the next step then in coming out this way and then into startups. I was going to ask why. What attracted you? I think
so through this fresh tech process, we created a lot of firsts because that's what it's about. Mm-hmm. Creating like a solution to a problem that's never existed before. If it existed, it would be solved already. And the frustration that I began to run into inside of Pfizer was they loved the idea. I ran into the next level problem, which was, okay, we identified how to create the ideas, but now how to take them to the next level, people have to be willing to do things that nobody's done before.
Yep.
And inside of a fairly rigid, structured organization that really is pretty conservative at the time, maybe they've changed, but I don't know if they have. I was creating these technologies, like we came up with one of the first puncture sealing devices, for vascular, right?
Mm-hmm.
After seeing people like leaning on people's groins. In fact, we, are really around the same time. Datascope was an early player, VasoSeal, but we were actually working on it before VasoSeal even announced their product. And so anyway, but it only got so far inside of Pfizer, and it got very frustrating. And then the most frustrating thing was after, let's say, years ago, creating these things, and they go, no. And then, like, years later, it's like, we should buy this company. I'm like, well, we came up with this, or something like it. Like, we had it in our hand. We could have owned it all, And they just wanted the risk retired, And that's what began to frustrate me. I said, and the other thing was that I just felt like they loved my little group, and they would put me on the magazine covers and stuff like that and talk about fresh tech and be so proud of it. But they didn't want to really do it. And they just liked it. They liked saying they were innovative, but when it really came down to actually implementing, there was all these barriers internally, and they really weren't willing to be open-minded about how to get around them. So I was basically forced to leave because I felt like if I stay here, I will not achieve anything because everything I'm creating is running into this brick wall. And so I'm a reluctant entrepreneur. I did not pursue entrepreneurship to become a famous rich person. I pursued it because it was the only way I could achieve my goals.
I think reluctant entrepreneur is going to become the title of this. All right. So startups because of that reason.
Yeah.
Why start up ExploraMed? And can you explain the vision and the model of ExploraMed?
Yeah. So, I've proven that this process works. The innovation process works. And we had created all these things. And they could have been companies, but they weren't necessarily thriving inside of Pfizer. And so I went and at the time, this is like sort of the heyday of med devices. Like this is a big time, like such different, like so many companies being funded and just a really awesome proliferation. It was definitely a hot time for medical devices back in the late 80s, early 90s. And I walked around to a couple of VCs and said, I got this idea. I don't have any ideas because everything I've invented before is already at Pfizer. So I did start from scratch. But the idea is, give me a little bit of money and I will come up with this next thing. And here's my process and here's my track record, but I have nothing. It's a blank sheet of paper, but trust me. And then I think I can come up with something. And I got a few nibbles from some really good quality firms. But the key relationship was, Bob Anderson, who's one of my mentors at Pfizer. That's where I met him. He founded Valley Lab, which is big medical device company, now part of Cofounding. And he said, you gotta work with John Nera. And John was at NEA, and former Alex Brown banker, really deep into medical devices, and a really, just an awesome human being. And so John wrote, was willing to write the first check. And so with as little as $500,000 from NEA, back in the days when they wrote checks like that, of that small size, and I think Bob chipped in 200K. So it's $500K from NEA, 200K from John Nera, and 50K from somebody else, and that was ExploraMed. The first ExploraMed, and the vision was, with this small amount of money, we're going to vet stuff and kind of stand up a business. But we'll start with this need, sort of the process. We'll use the process to go find it. And we wound up creating 2 companies out of that.
2 out of the 750.
Yeah.
It's a good start.
Yeah. They one of them needed a lot more money than that. But it was just sort of to get to Series A. Get to Series A.
Of course. Yeah. All right, so key lessons out of that experience, the entire ExploraMed experience.
Oh, the entire one.
Yeah, all the way through.
So, people are everything. More important than the idea.
Why?
Oh, because, I sometimes think like the idea is got to be exciting enough to draw the best and brightest people to it. Mm-hmm. And then when the best and brightest people come to it, then if they're given the freedom and the opportunity, then they actually really create what the company is. I mean, a company is a company of people, not of a product. It is a living thing, mm-hmm. and the product is just a thing. So that's the big learnings. And, and also valuing people who play as a team rather than for themselves. And so one of the things that, as you know, and I know you've done this in your career as well, you seem to sort of wind up with the same people over and over again, and that trust builds, and there's a reason for that. You dispense with all the uncertainty of not knowing someone or not knowing what they're good at and bad at. You know your own strengths and weaknesses. You know how they complement them, and they make it happen. So people being the most important thing in any organization is really sort of the first learnings.
And we all try to explain that to folks, but I'm glad you explained it the way you did, because it's a hard message to get across, but it really is people. Yeah. I remember, Denise Aarons talking about, don't fall in love with the technology. Be willing to, you're here to solve the problem.
That's right.
And make it, and that's decisions day in, day out.
Exactly.
All right. So people first. What's next?
Well, I think the other piece is be honest with yourself about what something is and is not. And I think entrepreneurs and founders have a tough time with this. I certainly did in my first go. You sort of, you look at these people who do these things that have never been done before, and you're like, how do you create that vision of what that is if it doesn't exist yet? Are you lying? Are you faking it until you make it? I hate that phrase, by the way. I don't believe in that at all. But that isn't what it is for me. But I think that some people go to that because they don't know how to communicate it. But I think the biggest thing is to not tell stories to yourself about how good or how not good something is. Yeah. And to face that data down. Like when you do that first test and it sort of doesn't exactly work as planned, you got to come out of that with like, I got to fix that thing. Like that, you have to have that mindset. And when people go, your baby's ugly because of this and this and this and this and this, like you can't just go, this is a beautiful baby. You have to like go, you're right. How do I fix, Now, sometimes they're critical and it's not valid, so that can happen. But when it's valid, either data-driven or really sort of consensus feedback, you got to listen to it. And you have to adapt. And I think my first experience with transvascular, we had a very big idea. It was an impossible idea to bypass coronary vessels completely percutaneously with catheters that you're navigating the groin. Because we met through that, right?
We did.
So, like I said, best and bright. I couldn't pull you in at the time. You probably made a good choice. But anyway, we had that grand vision. I don't think we told ourselves enough truths about what the real problems were. There was always a way to look at the data and say, a little bit of light is shining through, so it has, let's keep on going to the light. But even if the hallway keep on getting narrower and narrower, the light get further and further away, and you don't know as a founder, like when it's, you got to change course, and that's what that was another learn.
So I think, two elements to this, right?
Yeah.
You've got to have that self-belief, because if you're doing something that no one's done,
right,
not many people are going to believe you.
Yeah.
Right. So you've got to have that self-belief. But then I think the other attribute that we keep hearing about entrepreneurs or innovators is persistence.
Right.
But you can persist too long.
Right.
So, I think in both areas here of self-belief but being objective,
right,
but persistent but not too long, I don't know, they're just tough things that entrepreneurs need to deal with.
Yeah, and I think people get confused because I totally believe perseverance is the key to success. Like, there's every opportunity to give up every single day. Like, there's always something, oh my God, so much. And differentiating that from things that are good reasons to change course, I think you have to, all of the deals, unfortunately, I don't have any Ardians. And not that was easy, but just like it was early to have a fantastic, amazing transaction. Never have I had that opportunity. All of the things that we've had to do, we've had to bring to market, go through. It's just so much, down the road, and I'm, and there's lots more opportunities to give up along the way.
Absolutely.
Yeah.
A lot more hurdles.
Yeah.
All right, got to ask this question, and I know you're not going to answer it, but I'm going to keep asking you.
All right.
All right, founded a ton of companies. What's your favorite?
Right. That's like saying, which child do you think is the best? So I can't give you a good answer on that one, because they all have their special place for me.
Yeah.
Obviously, the ones that didn't work out, those weren't good. But we thought we were on the right mission, and I've had failures. It's good for people to know about failures too. So I've had one company that we basically needed to shut down, and another that we had to sell for almost nothing in the end. So we haven't always gotten it right. So those are not the most favorite experiences, but they're probably some of the best learnings.
Yeah, and I think that's the key, right?
Yeah.
That I don't like defining things as failures.
Right.
They're opportunities to truly learn.
Yeah.
Yeah, I know that's trite, but I think it's true. All right. You then went on to run, and you still are running the healthcare group at NEA.
Well, the medical device group.
The medical device group, sorry,
Yeah.
just for any of the folks out there that I just pissed off. And then, so I have to go back to this for those folks I just annoyed.
Yeah.
One of the largest and most successful venture firms.
Yes.
What you learn being on the other side, on the venture side of this?
Yeah. I think that people think, well, first of all, people think that the venture business looks pretty easy from the outside, like, oh, you sit back, you write a check, And maybe I just wasn't doing it right. It's not that easy. I think it's a really hard business because you're evaluated on all these things that you're not an operator. You're just once you write your check, you're in, and then what happens. And I try to be an active board member and influence, and I have actually got really involved. But I think good investors don't need to do that. They just, I don't know. But I've had to do much more to get to a good outcome personally than in some situations than I think your average investor does. I'm probably just calling on my operating experience more.
Mm-hmm.
But it's hard. I am, I was, and I hope I still am, a person who is how do we do that, rather than no, we can't do that. And unfortunately, the big piece of being a investor is how many times you say no.
Mm-hmm. Yeah.
And I just don't like that. It really, really, grates on my soul to have to see a young or old entrepreneur with a great idea that I think actually is a good business and probably would make money, but not the right scale or some other part of the filter. The no's are the part that
I think that's an important thing for entrepreneurs to know too, that coming into NEA and seeking a $500,000 check isn't going to happen.
No.
Coming into a smaller firm asking for a $50 million check isn't going to happen.
Right.
So it's understanding your audience there. So there are a lot of no's.
Yeah.
I don't think there are too many ideas that I get to see that I don't think, we could make something with that.
Yeah.
But they're not always good investments.
Right.
So that's the key. Yep.
Well, they even could be good investments. I mean, unfortunately, like investing 5 and returning 25 million, which sounds like a great investment, would never ever fly at NEA. They're just too big.
Yeah.
So it's having to adjust to that filter, I think, was really difficult for me, and frustrating. I think I think we did okay, and we've invested in a couple of really great opportunities. But I think that the takeaway for me is I appreciate so much more now, like the essence of fit, like you're saying, and not to foreshadow some of the stuff that I like to do, but one thing I do think that you and I both could work on, one of the sort of partnership opportunities between our organizations could be, how do we create a matchmaking portal or some kind?
Yeah,
to,
absolutely.
Sort of say, like, don't go to these 20 other, they're never going to invest. Here, if we could figure out how to put the criteria that people really look into and then match that up with what they are, if they are willing to be honest with themselves about what they really are, then we could just facilitate this incredible, sort of marketplace in a confidential way, but just sort of like you matched to these, based on your criteria. And that way, like, then then it's good for me. I'm not saying no as often, and it's good for the entrepreneur because they're not getting turned down.
They're not wasting their time too.
Exactly. So the opportunity there.
I'm intrigued. So let's do that.
Yeah.
That could be fun.
Yeah.
All right. So you've founded companies, you've led companies, you've incubated companies, and you've funded companies.
Yeah.
Which of those roles is your favorite?
Yeah. I mean, I do love the innovator piece of it. I love...
So the founding.
Yeah. I mean, well, I'd say it's I tell you what I love is being a part of, and this translates also to others, helping others do it. So it's not just me, myself, but the greatest thrill in life is to do something that's never been done before that works and helps people.
Yeah.
I mean, it is like, oh God, give me more. I'm addicted. I mean, to do something that works, never been done before, breaking new ground, and, like making jobs, it's jobs for people. It's like outcomes for patients. It's, it's all those good things, success for investors, for our partners, it's all that stuff is just like, that's the best part. And helping other people do that is a part of that as well. And, as because you're a great leader and have established just so many great relationships and built so many careers, you feel like a pride for what the people that you helped get there, and so that's why this role of biodesign has piece in that, but also being a leader and a innovator in company is a piece of that too, because the people that channel their talents through that if they benefit and they go to the next level, and then you see them, inventing their own companies or doing whatever's next. It's you feel like a small piece of pride for them and what they
Yeah, a
do.
lot of pride with a small contribution. Yeah,
Yeah.
no, I get you.
Yeah.
Yeah, definitely. All right, now you've done something else outside of MedTech.
Yes.
Right, so you've married your love of process, your love of innovation with your love of wine.
Yeah.
Tell us a little about co-founding Carve.
Yeah. So one of the guys that I hired into Pfizer, I think it was his first full-time real job, Greg Lambrecht, who is a good friend, and I hired him as a summer intern to do Fresh Tech, and then he came, and then I hired him to come in and help me run the strategic innovation group, and we did that for a couple of years at Pfizer, and he is just a amazingly fun, outgoing, positive energy, constant Energizer Bunny type guy, and he's also a MedTech entrepreneur, and I've have helped him, and he's helped me with my companies, and so we've stayed in touch all these years. And one dinner we were having together, he pops this bottle on the table, completely empty, never been opened. He was like, I drank this bottle, and I did it over the course of a year. And I'm like, okay, I'm looking for like, put it back together. Where's the scene for glowing it? And then he pops this rather, funny looking object on the table, and that was what he was calling the wine mosquito, which thankfully we changed the name.
Yeah, good engineer,
Yeah.
good marketer.
Yeah. Anyway, and he said, so this is, the concept is take a glass of wine out of the bottle without ever exposing it to air. And he used the biodesign or whatever process, the Fresh Tech process to come up with it. Like, I need to drink a glass. My wife is pregnant. How do I drink only a glass and only a good bottle that I'm not going to throw out the bottle? And so, brilliant guy invented the technology. And after playing with it, he gave me one, and I played with it for about a year, and I loved it. I couldn't drink wine without it. And he built pieces of it in his garage. And then I said, Greg, this got to be a company. And so the two of us founded Cofounding, and it's been an amazing experience. It's been my first consumer experience. I learned a lot about consumer through that. But it's the most fun company ever. I mean, you're in wine, you make people happy, you're talking to people who love food and wine. What could be bad? It's
But
good.
it also, the first time I thought about it, though, that you've done in the later ExploraMed companies, there's been a few consumer facing companies.
Right.
Did you learn from the Caravan experience?
Absolutely. No,
Yeah.
I mean, we founded the company, and 2 years later we launched a product, and it was like millions and millions of sales. And my previous experiences, it took us like years to do that, and through all these struggles, and and then we get to the beginnings and every step of the way. But the opportunity just to flip the light switch on, here you go, world. And if you set it up right, the consumers came out of everywhere. I mean, we quickly, I think that first quarter we sold maybe $5 million worth of product. And like, if that was a MedTech company, we'd be talking like, we are going places.
Yeah.
So I really learned from that. And then the question was, can we think about medical devices differently, or think about medical technology differently, and say, like, if you were to say, hey, I want to solve a big medical need, but how do I do it in a way that I could distribute or give consumers access to this solution, rather than having to work through reimbursement, regulatory, all those complexities. And, like, for example, if the bicycle had never existed before, and I said, I think I've got a way like to combine a need for transportation and cardiovascular health at the same device, like, how about a bicycle, like, wow, that's cool. It's going to help people with heart disease, So I thought, okay, maybe there's opportunities like that. And then I went hunting for, what disease states or what conditions might be amenable to something that would appeal in the consumer mode, and just not necessarily trying to force it, but just sort of say, like, I'm going to open myself up to the range of solutions that include non traditional medical
Yeah.
solutions, and that's where Willow, you
Yep.
know, came from, and Newell, and so yeah.
Just had me thinking about the regulatory, is it 510K or PMA for a bike?
Right.
Yeah.
Yeah, right. If you had claims.
I think it's been grandfathered in.
Yeah.
So thank
Exactly.
goodness.
Yeah.
All right, let's move on to next steps.
Yeah.
Right. So you've been associated with Stanford for 20 plus years. You're one of the founders of Biodesign, which is celebrating its 20th anniversary. You're taking over, as I said, for the incomparable Paul Yark. What's the plan? What's the vision?
It's a huge honor to have this opportunity, and pick up where Paul has sort of brought it. He's an amazing human being and a incredibly generous and kind, thoughtful, brilliant person. And so, I will try to aspire to his the soul that has been embedded in biodesign, through him. What I'd like to do is try to bring everything forward that we're doing that's good and keep that going. Biodesign is really created by a community. It is the community. I mean, we created it that way. We embedded in every step in the teaching process and the mentors and everything. It's all everyone. So it is a community project. So I want to keep that spirit going and make it about the community, for the community, and our students and broad faculty and people across the world. As I look ahead, I think that there's opportunity to just sort of think a little bit more broadly about what we could be doing, and perhaps bring a little bit more structure and organization to some of it. But I think the sort of pillars are like, how do we, like this idea that we just talked about being a matchmaker and trying to facilitate. I think, the goal is to try to, obviously educate innovators. That's our mission, is to educate and create a framework for educating, the next generation of healthcare technology innovators. And so how can we do that better? How can we do that more effectively? And there's some tools that we can bring to that. One of the other parts of that in supporting that innovation ecosystem is how Stanford and biodesign in particular can play a pivotal role in doing that, and policy touches on that. As you and I know, we both worked on this together. There's really a role for a voice in the debate that brings data and brings sort of an unbiased view, but one that's really oriented towards trying to get access for patients for new technologies and create an environment that those technologies can thrive and get to patients and improve people's lives and solve important problems for disease. So that is the ultimate mission. And one arm being certainly policy, but I think also, how do we make that opportunity more available to a broader group of people, a more diverse group of people, and both not just, racial or sexual orientation, but really economic as well. And I think sitting here in Silicon Valley, we are probably rightfully accused of not really thinking about how some of the technologies that we create disrupt other parts of the world and country. And, we need to sort of think a little bit broader, like, we need to come together and work hard on, making sure that there are not haves and have-nots, and access and both for health technologies, but also for the opportunity to participate in the creation of them is important for all of us, because we have to live together and we have to thrive. And we are not thriving if part of our world is not thriving, So that'll be an important piece of the future as well.
Yeah, good. What we're doing, again, what you're doing is applying the biodesign method, right? And then
Yeah.
understanding that clinical needs may have been too narrowly focused before.
Right.
So, yeah, good. So again, a balance of healthcare policy and social policy.
Yes.
Great. All right. Give you a last one.
Okay.
Right. Well, actually, two more.
All right.
Right. One to the young folks out there.
Yeah.
Looking back over your career, what have you learned? What words of wisdom would you have for somebody starting off their career in healthcare?
Yeah. Always keep the patient or the person who you're trying to help in the full center focus of your mind.
Mm-hmm.
And that, is the most important thing. If you do that, you will be successful. And that means listening to data. It means building the right team. It means persevering for them, and making sure you're doing it for that need, for that person. Obviously rooted in that, of course, is the need. There has to be a well-founded need. There has to be a clear spec to shoot for, and do not deviate from that. That is the golden thing. Unless you find out that it wasn't true, then you should go fix it. And sometimes when you're in the project, you learn that. But yeah, keep that patient, keep that person, that disease that they have, that you want to try to right in the center, and think about that person being you or your loved one, and that helps make all the right decisions.
Gotta tell you, I've heard a lot of folks who are, by any definition, successful.
Yeah.
So yourself, Fogarty, Tom Fogarty, John Simpson, Paul York, all say exactly the same thing. Exactly the same thing.
Wow.
Patient first.
Mm-hmm. Yeah.
Yeah, well, and I hope folks listen.
Yeah.
Right?
Yeah.
Patient first.
Yeah, absolutely.
All right, last one off script.
Okay.
Off my script, anyway. You don't know what my script
Yeah,
is.
I don't know.
Tell us something about Josh that no one else knows.
Oh. Let's see. Well, let's see. Very people probably know that I am probably dyslexic. So I could count the number of novels I've read for pleasure on, less than the fingers on one hand.
Wow.
I have read a lot, forced myself to do it. I can get through emails. Of course, I'm reading emails, but it takes me time. And so, yeah, there you go.
Awesome.
So,
yeah. Vulnerability.
Yeah, it's a part of just seeing. I mean, it's helped to feel like an underdog that needs to work harder, and it's just not going to just come. Like, you have to actually pull yourself up to do it. So that's part of some underlying, psychological part of why I need to learn. Why I need to know and understand. Like, I don't just take it for granted. Like, I have to make it simple for myself so that I get it. And then once I get it, then I get it. But I never think that I'm just going to get it. I realize I got to work for it.
I can't imagine you ever as an underdog. But that's it. Yeah, no, that's where it needs to be. Yeah, no, I get you.
Yeah.
Totally get you. Yeah. So thank you. This has been awesome.
Thank
Looking
you.
forward to a good partnership.
Thanks, Andrew. Yeah,
Thanks,
same
man.
here. Thank you.
Thanks. I hope you enjoyed learning more about yet another trailblazer in our industry. Please join me again for future episodes in our series. To keep informed, please subscribe, and I can't believe I'm saying this yet again, please like our content. We also want to hear back from you with names of MedTech leaders you believe are trailblazers, and whom should we consider having on the show. Until next time, I'll leave you with one of my favorite quotes from Hannibal of Carthage. I will either find a way or make one. Cheers.